right, welcome back. So now we're going to talk about urinary tract infections. We're going to start before we get to the infection about cystitis, and that's an inflammation condition in the bladder that it may or may not be caused from an infection. Um, Cystitis itself is the inflammatory process going on inside the bladder, and common causes that are not causes for infection that cause cystitis can be from drugs or chemicals. Sometimes local radiation can cause some bladder inflammation. It also can be used from an irritant, such as feminine hygiene sprays, spermicide jellies. Can also cause this problem. Long-term catheter use can cause cystitis without infection. Cystitis may occur as a complication of other disorders such as gynecological cancers, or some pelvic inflammatory disorders, or endometriosis. So just remember that cystitis is the inflammation of the bladder. It is not necessarily the urinary tract infection. Cystitis with infection is the urinary tract infection. Hope that makes sense. When you're looking at different urinary tract infections, it's important to know the cause of the urinary tract infection because the different causes have very different treatments when it comes to the urinary tract. And factors contributing to urinary tract infections are listed very nicely on table 66-3. It talks about whether it's an obstruction from an incomplete bladder emptying, leaving that urine there to grow bacteria. Can it be from a renal calculi? A large stone can obstruct urine flow, and bacteria can live within that stone and cause reinfections. Is it from diabetes because the urine has glucose in it and is now a breeding ground for different types of infection? We also need to look at gender when we're talking about factors contributing to urinary tract infections. Women can be susceptible to urinary colonization. Sometimes it's just from not wiping correctly or from using douches or perfumed pads, wearing too tight of garments, not allowing for breathing there and allowing for colonization. It can be from bladder displacement during pregnancy, can also predispose patients to having issues with pyelonephritis and other types of urinary tract infections. For men, it can be from increased age and prostate enlargement. It can also be from prostatic secretions losing their antibacterial characteristics, predisposing from bacterial proliferation. It can also be when men, it can be from sexually transmitted diseases, can cause urinary strictures, obstructing the flow of urine and predisposing them patients to urinary stasis. So all of those can be contributing factors to urinary tract infections. Sometimes when patients are sexually active, can be a strong risk factor for developing urinary tract infections, especially in females. And also if patients have been on recent antibiotics, because remember when we're on antibiotics, it changes our immunity and we lose some of our natural flora, and that can also cause urinary tract infections. But we do want to make sure that we're looking at those factors for contributing to urinary tract infections. A lot of times it's very simple causes. It can just be from what we listed there. But most patients who do have a urinary tract infection in the bladder area will complain of burning, painful urination, the constant need to void. Their urine will be very cloudy. It will be foul smelling. And so these can all be causes of urinary tract infections in the populace. It's interesting to note that most urinary tract infections, in fact, 90% of urinary tract infections, are caused from E. coli. And if we think about where E. coli is common, and that's in our bowel, it comes from improper wiping. And this sometimes can be the reason for these urinary tract infections. There are other causes, but 90% of urinary tract infections are caused from E. coli. Catheters are the most common factor associated with new onset urinary tract infections in the hospital and in long-term care settings. So there's all kinds, and we'll get to that in a few minutes, about they call them CAUTIs, to make sure that patients do not keep a catheter very long anymore, and that we're doing proper hygiene and Foley care on these patients so that they do not develop a urinary tract infection while they are in the hospital. So, what are some things that people can do to prevent urinary tract infections? Well, a lot of times when patients are, not hospitalized with their urinary tract infection, we can teach them both patient and family education, and that's listed in chart 66-8. It's things like drinking plenty of fluids. With your female patients, it's making sure they're wiping from front to back. This is also important because a lot of times people who are in heterosexual relationships, dad may help the young daughters, especially with potty training, go to the bathroom. And they may not realize the importance of wiping from front to back. So it's important for those who work in pediatricians' offices to make sure that they're teaching about that need to wipe from front to back with the female genitalia. And I just start with it very matter of factly. Even when dealing with very young little girls, I'll make sure that I teach both mom and dad the proper way to wipe a diaper, and then as I'm teaching that, I also make sure that I add in as these as the little girl gets older, we have to make sure that we're continuing to do that wiping from front to back. But that chart on 66-8 is very useful in teaching us how to prevent urinary tract infections outside the hospital. The table there in 66-8 talks a lot about hygiene, both for men and women, prior to and after sexual intercourse. And I just really, a lot of times, will bring this up, when we're talking about that, whether I'm helping a female, someone to the bathroom or what have you. I try to bring that up very nonchalantly as the importance of making sure that we're keeping that area clean, especially if we're having history and reoccurrent urinary tract infections. It's good to mention just basic hygiene as that it can be a reason for these urinary tract infections as well. And I think sometimes just bringing it up and discussing it when you're alone with the patient is sometimes the best time to do that. The other type of another type of urinary tract infection is the catheter-associated urinary tract infection, or the CAUTI. And this is one of the things that JCAHO looks for inside the hospital environment. Because infections of the urinary tract can lead to life-threatening complications, including pyelonephritis and sepsis, it is important that we try to keep these at a minimum, especially when the patient's already immunocompromised or in the hospital. Factors that are predisposing problems when you have a patient who has a urinary tract infection can be if the patient has obstruction, reflux, renal calculi, or diabetes. All put patients at greater risk for having urinary tract infections. When minimizing catheter-associated urinary tract infections, this is on chart 66-7. Big thing with that is get them out as soon as possible. Make sure you're using good hand hygiene when you're manipulating the catheter. Make sure I've already said it once, but get them out as soon as possible. Ensure that you're emptying them correctly. Make sure we're using that we're not breaking the system in order to like get urinary samples, that we're keeping that system intact, that we're emptying the bag regularly and using a separate clean container for each patient when we're doing that. It's important just to look at that chart 66-7 as far as ways to minimize urinary tract infections. These have become very expensive inside hospitals just because a CAUTI can lead to urosepsis, and urosepsis is associated with a mortality rate of 30% here in the U.S. So now that's a next semester kind of thing when we're talking about sepsis, but it is important for us to realize that just making sure that we're using good hand hygiene and proper care of these urinary catheters can help prevent, life-threatening life-threatening things with these patients. So make sure that you look at that chart 66-7. Just a few more quick points on catheters in the hospital. It's a Joint Commission requirement to try to get Foley catheters out as quickly as possible. Remember that urinary catheters are not left in place for staff convenience. That there are other methods of urinary control other than a Foley catheter, and that Foley catheters are not left in place for staff convenience. Reasons that a urinary catheter would be left in place would be because of the need for accurate I&O for and the patient is incontinent. It can also be because there is a wound, sometimes a sacral decubitus, something like that, that we need to be able to keep the urine away from it. But there are very specific reasons on why it's okay to have a urinary catheter in the hospital these days. And because we want to get them out as soon as possible, and staff convenience is not a reason. Another sign of urinary tract infections, especially in the elderly, is a lot of times if you find an elderly patient is now confused where they haven't been in the past, a lot of times that can be from a urinary tract infection as well. So if it's not related to their oxygen saturation or vital signs, they all seem to be pretty good, start to look for that urinary tract infection in the geriatric population who's suddenly become confused. The big thing medication-wise that I want you to know about urinary tract infections is that it's important to treat for the specific organism. And with that being said, it's important to get a clean catch urine. So that means midstream. I'm sure you learned about that in health assessment class, how to get those cultures done so that you can get the culture and sensitivity. Most of the time, these patients are started on a broad spectrum antibiotic, and then after the sensitivity is back, they are placed on a antibiotic that is more specific to the organism that they are growing. So that's what I want you to be able to know about that is that you have to have a clean cut urine or a Foley specimen to do a culture and sensitivity on urine, and that it's important to start treating for the urinary tract infection. They usually will treat with broad spectrum antibiotics and then get more culture specific. You also always want to make sure that you get your culture and sensitivity lab work completed prior to starting any antibiotics. That's also very important to do. We will come back in a few moments with kidney stones.